Welcome back, my people. We have started yet another very important topic today about vomiting. We have discussed vomiting in adults. We know what vomiting is. And in this second video, we've been discussing about vomiting in babies. And before we continue, I always appreciate you people for making this channel a success. It's all because of your support that I have the energy to forge on and keep on making video each and every day. For those who are appreciating my work, I always thank you and appreciate you back. Let's continue subscribing. Let's share. Let's like our videos so that they may be recommended in the whole world. For those who have not subscribed, consider doing so. And if you subscribe, don't forget to put the notification bell on so that whenever I produce any video, YouTube will automatically notify you and you will never ever be left behind. Let's talk about vomiting in babies or young children. So, the common causes of vomiting in babies or young children include the following. 1. Viral gastroenteritis. We are aware of this because we discussed about it during food poisoning. We discussed about viral gastroenteritis in depth. Number 2, swallowing milk too quickly, which can be caused by the hole in the bottle teeth being too large. So if the bottle, the hole in the bottle teeth is too large, it will make the baby swallow the milk too quickly, and this might cause the baby to vomit. Number 3, we have food allergies. The same way we can have food allergies in adults, we can also have food allergies in young children. We have milk intolerance, or when the stomach cannot sustain milk products, for example, prolactin and what we call lactulose. So it might make the baby throw or vomit. We have other types of infections, including UTIs, middle ear infections, pneumonia, meningitis. All those can make your child to vomit. Another point is that accidentally ingesting or swallowing poisonous substance or poison. Accidentally ingesting poison. Next, we have congenital pyloric stenosis. Congenital pyloric stenosis. This means it's childborn, or the child was born having this problem. And what is a congenital pyloric stenosis? This is a condition present at birth in which passage from the stomach to the bowel has narrowed, so food can't pass through easily. So if the food can't pass through easily, it's like there is a narrowing which causes a bit of a blockage. So this can predispose the child to vomiting. We have intussusception. Intussusception. This is when the bowel telescopes. The bowel telescopes in on itself, resulting in a blockage, and it's always a medical emergency. Telescope means it coils and may make a true or a false knot. So when there is that knot, it will be so impossible for food to pass by, and this can make the child vomit, and it's always a medical emergency. Let's talk about vomiting when pregnant or pregnant mothers. Causes of vomiting in pregnant women include the following. Number one, morning sicknesses, and you all know about this. We have acid reflux. We have foodborne illnesses, for example, food poisoning. We know about it. We have migraine headaches. We have sensitivity to certain smells or tastes. This is always due to hormonal imbalance. You might find a lady after smelling some smells or some tastes, the lady will tend to vomit because she becomes sensitive to such smells or such tastes due to hormonal imbalance or hormonal changes. Next, we have extreme morning sickness, also known hyperemesis gravidarum, caused by rising hormones. That summarizes the causes of vomiting in pregnant women. I hope we are getting all these points because this is very important. So, let's talk about vomiting during menstruation. Somebody will ask, how can somebody get vomiting during menstruation? Menstruation is always caused by hormones. So, hormone changes during menstruation can make you nauseated or feel like vomiting and make you throw up. Hormonal changes or hormone changes during menstruation can make you nauseated or feel like vomiting, and actually you may end up throwing up or vomiting. Some women also experience migraine headaches during their periods or their menses, which can also cause vomiting. Let me repeat this. Some women, as I was saying, some women also experience migraine headaches during their periods, which can also cause vomiting. We have talked about vomiting in children, vomiting in adults, vomiting in pregnant ladies, vomiting during menstruation. So, the next point of discussion will be how to treat vomiting. How to treat vomiting. Treatment of vomiting depends on the underlying cause. This is very important. Treatment in all types of vomiting can be the same. It all depends on the underlying cause. Drinking plenty of water and sports drinks containing electrolytes can help prevent dehydration. We have talked about this time and again that vomiting and diarrhea can lead to severe dehydration. So, during the treatment of vomiting, it depends on the underlying cause. And drinking plenty of water and sports drinks containing electrolytes can help prevent dehydration. This marks the end of our discussion today. And in our next video, we'll be discussing in details treatment of vomiting in adults, treatment of vomiting in babies, treatment of vomiting in pregnant ladies, and the treatment of vomiting during menstruation. We will discuss all those 4 categories in details. So my people, thank you for the support. Thank you for your time. Thank you for being with me. So let's continue subscribing, liking, and sharing our videos and make this channel a big success. Let's meet in the next video tomorrow.